we're getting zero cooperation on the personnel part of the Senate portfolio, which is confirming nominations. Therefore, we will be in session the first 2 weeks of August that we had originally anticipated not being here. We will be here.
The problem the Republicans are having with health care is not time, it's the substance of the bill. They can spend 2 more weeks, 2 more months, 2 years. As long as this bill continues to cut taxes on the very wealthy and hurt working Americans, the bill's going to be as unpopular as it is today.
All right, so the agenda items keep piling up, but on health care, Senate Majority Leader Mitch McConnell is sticking to the timeline of senators getting the bill Thursday, a Congressional Budget Office analysis early next week, and then hopefully a vote sometime late next week. Here now is Senator John Thune, who is the 3rd highest-ranking senator on the Republican leadership. You know, one of the things that Chuck Schumer was wrong about right there was this idea of cutting taxes on the wealthy. In fact, what we're looking at is that Senate bill is likely will keep the ACA's taxes on high-income households. It would leave in place that 3.8% tax on net investment income and 0.9% on payroll tax. Is that true, and does that make sense?
Well, that's part of the latest draft, Melissa, and frankly, my preference would be to get rid of all the taxes. The taxes were raised to pay for Obamacare. We are repealing Obamacare, therefore we ought to repeal all of the taxes. But we have a lot of our members and who want to keep those high-end taxes in place, repeal all the taxes that affect consumers and raise the price and cost of things out there, including health insurance, to get rid of all of those, but to use some of those other revenues to plug back into the bill and provide some assistance to people who will need it the most. So that's the current state of play, and obviously we'll continue to work with this. Nothing is final at this point, but I think we have a number of our members, in order to get to 50, who might need that as part of their requirements.
It might be the first time in my life that I was disappointed that Chuck Schumer was wrong there. Let me ask you about the Cruz amendment, you know, which talks about allowing health insurance companies to have the freedom to put out all kinds of different priced plans out there if they have one that complies. There's a lot of steam behind this, it seems. What do you think of it?
Well, I think that's one of the things that the conservatives fought hard for, and you know, we've got it over at the Congressional Budget Office is being reviewed and scored and analyzed to determine what the impacts would be. How does this affect the overall pool? How does this affect coverage? How does this affect premiums, et cetera? But I think it's just on the merits itself, on the surface, makes sense. Let people buy the plan they want to buy, as long as the plan with all the bells and whistles is available out there. So there's a lot of, I think, merit to this idea, the impacts and how it works across all the different insurance pools and how those rates would be affected is still something we have to take a look at.
So from our point of view, it does seem like you guys are meeting and working, because we book people and all of a sudden they're dragged into a meeting on health care or they're heading over to the White House. One person who doesn't seem to be going to meetings is Rand Paul. I mean, he said earlier today that no one's brought him in to kind of talk about the different things that he's mentioning on television that he doesn't like. Does that mean that he's sort of being counted out at this point, that there's no way to reasonably win him over?
I don't think we're counting anybody out. I mean, we've got 52 Republicans. We have very little margin for error. And if there's a way that Rand can find his way to be supportive and vote for the ultimate product,
then why isn't he being invited to anything?
Well, I think he is. I mean, all our members have been involved. Remember, we've had somewhere on the order of 35 or 40 meetings of all Senate Republicans, and so he's articulated his views. He has some specific ideas, things that he would like to see done, some of which I think could be incorporated into a bill, some of which may not be able to get there. But if we get 80% of what we want on this, that's a win.
Yeah.
And obviously, we have a responsibility to rescue people from a failed system. Obamacare is in a death spiral, and that's why we've got to act, and we've got to act fairly quickly.
That timeline that we mentioned on the way in, how realistic is that to you on a scale of 1 to 10? What would you say?
Well, I think it's realistic because, you know, we've
Give me a number.
Well, on a scale of 1 to 10?
Yeah.
I think
10
right
being
now,
very likely.
Okay, well, I'd love to give you a 10 plus, but let's say realistically, I'm a practical guy. Let's say it's a 7. I think that the chance that we can get a bill, get it scored, get it on the floor, open it up for amendment, have a bunch of amendment votes next week, and have final passage by Friday of next week, I still think that's a good possibility.